So I'm going to talk about pain in autistic adults. But before we do that, I want to talk about your pain. How much pain are you in right now? On a scale of 1 to 10, how much pain are you feeling right now? You got that number in your head? Why'd you pick a 4? If you picked 4, why didn't you pick 3? Why didn't you pick 5? Do you think your 4 is the same as my 4? Why do we ask about pain in this way? Well, we want to make sure that we can quickly and accurately understand your pain. The goal is pain relief, right? So, if we can get a sense of what your pain is pretty quickly, then we might be able to address it even faster. And if you come into the clinic and tell me that you're feeling a pain 4 right now, and I can give you medication, and a couple hours later you're at a pain 1, I know we're on the right track. We also want to understand your pain well because it helps with diagnosis. If we can understand what type of pain you're feeling, is it burning, is it stinging, things like that, that might help us with your diagnosis. We also want to be able to address your pain quickly when it first starts, when it's acute. If it's acute and we can address it well, we might be able to prevent it from turning into chronic pain, at least a little bit. So it's really important that we can understand what your pain is quickly and as accurately as possible. But I want you to imagine you're traveling. You're traveling to a country where you don't speak the language. That night, when you get there, you wake up in horrible pain. Maybe it was something you ate in the airport, maybe not, but something is really wrong, and you need to address that. So all of a sudden, you're in a situation where you're going to the hospital or the clinic trying to tell someone about your pain, and you can't easily explain what's going on. So it really begs the question, how do we communicate about our pain? Well, maybe they will look at your facial expressions, maybe they will try to understand what's going on based on your gestures, maybe they'll pull out that scale of 1 to 10, and you can tell them it's a pain 4. But it's not going to be as easy for you to communicate about your pain as it was when you were at home. And I want you to think about that situation when we talk about pain in autistic adults. Autistic adults might be dealing with something like this when they're trying to communicate their pain. Autism is characterized by social communication differences. So when we talk about pain communication, that might be a place where those social communication differences really impact their way of life. We also want to think about sensory differences in autism. You might think of this normally as sensitivity to bright lights or loud sounds, but it can also be an issue when it comes to pain. It can extend to those other sensory domains. And so being able to understand what's going on for someone for an autistic adult and what they're experiencing in their own pain and how it translates how they can communicate about it is something that we strive to do in the lab. So the question becomes, is pain the same for autistic adults? Well, I think it's really dangerous for us to make that assumption that it's the same. In fact, if you're asking about your pain and you tell me it's a pain 4, I'm not making the assumption it's the same as mine. And I don't want to make that assumption for large groups of people like autistic adults. We also know that autistic adults are dealing with more chronic pain conditions. More and more they're getting diagnosed at higher rates. And so something clearly is going on. We also know that pain, if you can't communicate about your pain well, that it raises the stakes for patient encounters. If you go in and you're worried that you won't be able to communicate about your pain, that might increase your anxiety, your stress level, which could increase your pain. And the provider that you're seeing in clinic might be concerned that they can't administer the same level of patient-centered care for you. So in the lab, we want to understand, how is pain different for autistic adults? I'm a neuroscientist, so we want to look at the brain and understand what's going on the neurological level to see if there's differences there and how those translate to how people talk about their pain and communicate about their pain, so that we can give people better tools to communicate about their pain. So how do we do this in the lab? We bring people in and we give them a small heat stimulus. It kind of feels like if you microwave a coffee cup and it's a little too hot, it's got to be painful because we want to understand what's going on when you're in pain, but it's not going to burn you. We use this device called a thermode. You can see there in black. That's what would actually touch your leg. And it's about the size of like an Apple Watch. We put that on someone's leg, we put them in the MRI, and then we can look at how the brain is responding based on increased rates of blood flow to different regions of the brain. We know from decades of research now that the brain responds in a very specific way when people are in pain. We see increases in red and orange in regions that are for emotion or sensory processing. So the question was, is this the same for autistic adults? So in the lab, we brought in non-autistic adults and autistic adults to look at how they're responding to this pain stimulus. We're giving them that heat pain for 20 seconds at a time and looking at how the brain responds. When we start off, right when the stimulus starts, the brain responds pretty robustly in exactly the regions we'd expect for those non-autistic participants. As we go on after a few seconds, we see the brain is still responding, maybe a little less. You tend to habituate to pain. But then even when the pain turns off, your brain is actually still responding to pain. It's a very important thing for your brain to pay attention to, and it likes to be able to understand what's happening and when it stopped. So then we looked at how does that compare to what's going on for autistic adults. When the pain starts, it looks pretty similar. The response is still there in the regions we expect, maybe not as robust, but it's still responding in the same way. But pretty quickly after 6 or 7 seconds, something dramatic changes. We actually don't see that response anymore. That brain response is not there in the same way as it was in the non-autistic adults. Now, they're still feeling that same heat pain, that same stimulus. That has not changed. And they're still telling us they're feeling pain, but the brain is responding in a very different way. And when we turn that stimulus off, the brain is responding no different than it was at rest. This really says to us that there is a very big difference in how autistic people experience their pain on a neurobiological level. And so it really begs the question for us to try to understand, should we be using the same pain scales? Does that response, that neurological response, translate to the same pain scales we're using to communicate about our pain? That's what we're still doing in the lab. That's the current projects we're working on. So what we're doing is bringing people in and we're comparing their responses on that number scale that we talked about at the beginning, on the faces scale, and we're trying out some new scales. One of our participants said, I really hate the faces scale. So we came up with a new solution, something called the volume scale. This is rooted in the idea of a volume knob that you can turn it up and down, and the triangle will become bigger or smaller based on your rating. And we felt like this was more grounded in a different sensory experience, and that might help some autistic adults express their pain differently. So if we know that the neural response is very different for autistic adults, can we develop better tools that match that neural response better and help in the communication of pain, especially in the clinic? If we can provide those tools to the patient, they're less likely, hopefully, to feel less anxious, to be less stressed about communicating their pain, and providers could understand better what that pain experience is and deliver more patient-centered care. And I think we all deserve that. Thank you.